Welcome to Medicus Aeternus, where the journey to mastering medicine never ends. We are here to make learning easier, more enjoyable, and to help you excel in your medical path. Let's dive in and learn something new today. Today we have our second video in our pharmacology playlist. It is entitled as Pharmacodynamics Part 2. So let's go on. Today we will discuss the antagonist effect. In the previous video, we have already discussed basic terminologies, concepts in pharmacology, and also we have talked about the agonist effect. We have talked about the efficacy, potency, toxicity, and so on. To learn more about the agonist effect, check the video in the link description below. Today, our topic will be about the antagonist effect, which is the second main part of the biological response to drug receptors binding. As a definition here, the antagonist effect means that when the drug combines with the receptor, it gives no response. Because when a drug binds with a receptor, it blocks its action. And as a result of blocking this action, the receptor that is meant to do a job is not able to do it anymore. And here we have two main types of antagonist effect. We have competitive antagonism and non-competitive antagonism. Or you can say as reversible antagonism and irreversible antagonism. As the name suggests, in competitive antagonism, the antagonist and the agonist at the same time they compete in order to occupy the receptor. And as a result, they will occupy a certain number of receptors, and they will either, if the agonist concentration is increasing, the effect will show. If the antagonist concentration is increasing, the effect will not be shown. Here you see in this diagram, if, for example, let's say for the sake of the argument that we want to put the antagonist effect in a diagram, we will not be able to draw a diagram just as we have done with the agonist effect, that as you increase the concentration, the response will reach to a maximum of Emax, the efficacy. No. In antagonism, as we know, it produces no action because it blocks the receptor. Hence, if you put it in a diagram, the antagonist effect will be as a horizontal line, which means that the receptor is not working, it's out of action. But in this diagram, let's see that we gave the patient or the subject, for example, an animal. We gave an agonist and antagonist. In case we gave the agonist alone, as you can see based on the information that we have already discussed in our previous video, that as you increase the concentration, the response increases till you reach a level of Emax efficacy. However, if you add an antagonist, there will be a competition. And as you increase the concentration of both of them, as a result, the agonist can overcome the antagonist and it will reach an Emax. Of course, you see here the delay of the response, but as a result, at the end, the agonist will prevail and the Emax will be achieved. And this kind of reaction, we call it surmountable effect. Surmountable effect is defined as the concentration of agonist increase, the antagonist effect decrease till it disappears. The second type of antagonism is irreversible, in which that if the antagonist binds with the receptor, it will never let it go. And the only way for the body to get rid of this antagonist is to get rid of the antagonist and the receptor at the same time and synthesize a new receptor. That's why it takes long time. It takes days, even long time, months. That's why some of the toxins are work by the concepts of irreversible antagonism. And luckily enough, most of the blockers, most of the antagonists are reversible antagonists. But let's also discuss how it will look like if we put it in a diagram. You can see here the agonist alone, it will reach the efficacy as we already know. But if you add an antagonist, the agonist will occupy, let's say, 50% of the receptors, and the antagonist will occupy 50%. There will not be any competition between them. Here, in the previous one, they will occupy 50 and 50%, but as you increase the concentration of the agonist, it will kick the antagonist away, and it will dominate at the end. But in this example, in case of irreversible antagonism, unfortunately this doesn't happen. The agonist will occupy a 50% and the antagonist will occupy 50%. This is as an example. They can occupy 70 or 30, 80 or 20, it depends. And as a result, the Emax will never be achieved. and this is called non-surmountable effect. A non-surmountable effect is no matter how you increase the concentration of the agonist, it will never reach the Emax, the efficacy at all. And many toxins have this kind of effect, and as I told that most of the antagonists, most of the blockers, and we will be discussing them as we go further in our course, most of them work by the concept of reversible antagonism. We have discussed two main types of antagonism, reversible and irreversible, but there are many types, other types, 4 types mainly: chemical, physical, physiological, and pharmacokinetic, in which means that these 2 drugs will compete within each other in a way that is out of seeking the occupation of the receptor. One of these ways is chemical antagonism, and a chemical antagonism mainly because one drug is an acidic and the other one is basic drug. And as you already know from basic chemistry, when you combine an acid and an alkali or a basic, they will equalize each other and the effect will not be produced by either one of them. And as a bright example of this kind of antagonism, we have gentamicin, which is an aminoglycoside, a antibiotic. If you add it with carpenicillin, which is also an antibiotic, but gentamicin is basic, whilst carpenicillin is acidic. If you add them together, both of them will combine with each other and they will neutralize each other, and the effect will not be reached at all. Second example is physical antagonism. Physical antagonism, the brightest example, here you have the heparin example. And what does it mean that these 2 drugs are antagonizing each other physically? It means that they have 2 different charges, positive and negative. And as you already know from basic science, from your high school education, that when you add a positive ion with a negative ion, positive particle with a negative particle, they will equalize each other, neutralize each other, and the effect will not be matched. And here you have an example. We have a protamine. It's used for the treatment of the heparin, the overdose of the heparin. And the protamine carries a positive charge, while heparin carries negative charge. That's why they neutralize each other. Heparin is a blood thinner. We give it to patient in case of atherosclerosis. And sometimes an overdose of heparin is deadly because it causes severe bleeding. In order to save the patient and to save his life, we can add this drug, and it will help to equalize the function of the heparin based on the physical principle, positive and negative charge. The third type is physiological antagonism, in which 2 drugs, they combine with 2 different receptors. However, the result that they produce are completely opposing to each other. In the beginning, we have discussed that 2 drugs, they compete for the same receptor. However, in this example, these 2 drugs are combining with 2 different receptors, and the results are completely opposing to each other. A very bright example we have in case of anaphylactic shock. In case of anaphylactic shock, histamine, which binds to the H receptors, it gives the result of vasodilation and bronchoconstriction. However, if we give the patient adrenaline, or also known as epinephrine binds on alpha-1 receptor and gives the result of vasoconstriction. It also binds on beta-2 receptor and gives the result of bronchodilation. 2 completely opposing responses. The fourth example we have is pharmacokinetic antagonism. Pharmacokinetics, we will discuss pharmacokinetics in the further videos, and I have already discussed in the first video that pharmacokinetic is what the body does to the drug, and it is divided into 4 main parts: absorption, distribution, metabolism, and excretion, which means that one of drug will affect the absorption or the distribution or the metabolism or the excretion of the other drug, and this is called pharmacokinetic antagonism. We will take an example for each one of these effects. The first one will be absorption. In absorption, here you see we have an example of antacids. They interact and they decrease the absorption of iron and aspirin. Also, antacids, they form insoluble complex with tetracycline, an antibiotic. And as a result, these drugs cannot be absorbed if you mix them with antacids. The second one is distribution. distribution. For example, aspirin, it displaces warfarin from protein binding sites. As a result, the increased risk of bleeding. The third type, we have metabolism. Here we have an example of rifampicin. It induces the hepatic enzyme and increases the metabolism of oral contraceptive pills. The other type, for example, we have cimetidine. It inhibits these enzymes. As a result, it slows the metabolism of warfarin and increases the risk of bleeding. For excretion, we have, for example, NHCO3. It causes alkalinization of urine and increases the excretion of acidic drugs like aspirin. Also, we have a different example. In case that aspirin, it competes with methotrexate for renal excretion, and as a result, it increases the toxicity because of methotrexate. If you are confused or want more context, check out the first part linked in the description. Thank you for watching Medicus Aeternus. Remember, the journey of a medical professional is eternal, and we are here to guide you every step of the way. Don't forget to subscribe, hit that bell for updates, and show some love by liking and sharing this video with your friends. Stay awesome, keep learning and thriving.